Monoamine oxidase inhibitors is the topic, abbreviated MAOIs. And these are medications used to treat depression. And the two most commonly used are phenelzine and tranylcypromine. So please remember those two. So they're used to treat depression, and depression involves low levels of serotonin, abbreviated 5-HT. So what these drugs do is they elevate the level of serotonin in the following mechanism of action. There's an enzyme called monoamine oxidase, and this enzyme breaks down several neurotransmitters into their metabolites. And which neurotransmitters? Well, you have serotonin, but also dopamine and norepinephrine. Now, monoamine oxidase inhibitors essentially block that enzyme. So if you block the enzyme, these neurotransmitters don't break down. And in particular, the one we're concerned with is serotonin. So if it doesn't break down, you will have higher concentrations of serotonin. And higher concentrations of serotonin in the brain can help alleviate depression. So now I want to talk a little bit about the side effects of MAOI drugs. And this is very highly tested. So it's important to remember this side effect. They seem to test the side effect more than they test the use of these drugs. And that side effect is something called hypertensive crisis. And this happens during a very specific incident. And that is when somebody taking these drugs ingests certain foods that contain something called tyramine. And those foods include cheese, wine, and a long list of other types of foods that you can get from the physician, so you know which foods to avoid. So very important to remember this, but now I will explain why does this happen. If you do indeed take something that has tyramine in it, cheese or wine or whatever, why then does hypertensive crisis occur if you are indeed on these drugs? I'll explain it with a little diagram. This is, of course, some neurons, and there's a synapse in the middle. And here you have norepinephrine sitting inside a vesicle. When you ingest tyramine, what that does is that this tyramine can go and displace this stored norepinephrine from these vesicles. That is the effect of ingested tyramine. So then norepinephrine enters the synapse in large quantities. Now normally, if the patient is not on an MAOI inhibitor, this norepinephrine is just broken down by monoamine oxidase. Right? So if somebody's not taking MAOI inhibitors, the MAO, the monoamine oxidase, will just break down this excess norepinephrine. That's why regular people who take wine or cheese will not develop hypertensive crisis. But if you're on monoamine oxidase inhibitors, remember those drugs, they block this breakdown. So this norepinephrine increases and stays increased. It doesn't break down. And that excessive norepinephrine is what causes the hypertensive crisis. So why does norepinephrine cause hypertensive crisis? Well, norepinephrine is a powerful vasoconstrictor. it vasoconstricts blood vessels, and that can cause increased blood pressure. So let's list the symptoms of hypertensive crisis. So you have a scenario where a patient is depressed and they're taking MAOI inhibitors, and then they ingest some form of food that has tyramine, cheese or wine, and then this tyramine causes that release of the norepinephrine. Norepinephrine builds up, cannot be broken down because the patient's on MAOI inhibitors. Symptoms are as follows: severe high blood pressure. Patient will also have a severe headache. Heart rate will also go up, tachycardia. Patient will also start sweating, diaphoresis, palpitations. So keep all of this in mind when approaching licensing exam questions about monoamine oxidase inhibitors. So now let's take a look at a few of those MCQs. Which of the following classes of antidepressants is associated with hypertensive crisis when combined with certain sympathomimetic drugs and meperidine and dextromethorphan when followed by foods with tyramine? So this is a very straightforward question that encompasses everything we just talked about. The type of antidepressant that can result in hypertensive crisis if you ingest tyramine are MAOI inhibitors. A 63-year-old man has taken an antidepressant for the past 3 months. He is on no other medications and is generally in good health. After attending a graduation party for his son, at which he consumes wine, bread, and cheese, he is rushed to the emergency room with tachycardia, headache, and a blood pressure of 200/100. Which antidepressant is he most likely taking? So this is a classic example of hypertensive crisis. And if you remember the names of those MAOI drugs, there's phenelzine and tranylcypromine. And finally, a 34-year-old woman is prescribed an antidepressant, which she has taken for the past 3 months. She is on no other medications and is in generally good health. After attending a party at which she consumed wine and cheese, she is rushed to the emergency room with tachycardia, headache, and a blood pressure of 200/100. Which antidepressant is she most likely taking? So it's the same scenario, and remember the names of the two drugs are phenelzine and tranylcypromine.